Tonight we're hosting the last of 3 voter education conversations designed to learn more about the issues that are important to older voters in Arizona. The focus tonight is on health care, and we welcome our panel of 3 registered voters. Joining us, Marcia Berry. Also with us is Paula McKee, and also joining us is Melanie Warren. Thank you all 3 for being here. We really appreciate it. Marcia, we'll start with you. Health care in general, how important of an issue is this in the grand scheme of things for you?
I think that the future of healthcare, and knowing that I have access to quality healthcare and good information to make sound decisions, and that there's the possibility of aging in place in a productive and engaged manner, is very important to me.
Is it the kind of thing that you're hearing right now from the candidates, yay or no?
Plus and minus. What I'm hearing is encouraging because it really speaks to what I am hearing is things like supporting families, supporting younger families, which enables those individuals to then support aging parents and aging family members. So the ability to negotiate prices in the Medicare arena, the ability to speak to home care, to being able to have those services readily available in a quality manner that's affordable is coming up in the conversation that I'm hearing.
Okay, Paula, as far as healthcare in general, where does it rank for you among issues that gets you to the polls?
I'd say it's probably my top issue, actually. And I'm interested in funding Medicare so that we can continue to receive the benefits and that Marcia was talking about.
If a candidate came to you or came to the state in any race and had an idea for radically changing the formula for Medicare, would that interest you, or would that make it put up a caution flag?
Definitely a caution flag, because it is such a complicated process to figure out how to fund. For example, if you cut taxes in one area, that's a good thing for most people. But then that might play out as an unintended consequence for defunding Medicare.
Right.
So all those things have to be thought out when thinking about another process.
What do you think, Melanie? How important an issue is this to you?
Extremely. I wish I had more information when I first started on Medicare. I was kind of going by the seat of my pants. I really didn't know what I was getting into. So I think information is key. I also think that since I've already voted, and I took care of that already, that's what got me to really make an effort of that.
Do you think so? More than any other issue, that's what got you to fill in the little holes there for the ballots?
Yes.
Isn't that interesting? Marcia, back to you. The cost of medical care, just the cost of straight medical care. You mentioned, someone mentioned prescription drug price. I think you did. It's got to be high on the list.
It is, because the pricing structures and the ability to negotiate are kind of a fundamental part of how you get to what's going to be your out-of-pocket. There have been some changes in the system with reducing the donut hole and reducing prices on certain very high dollar plans. I think the fact that there are so many prescription drug coverage plans, all of which have very different tiers, can be confusing for consumers.
If a candidate came along and could make that less confusing, goodbye you?
Oh, that would be very attractive to have somebody who would be, to be able to sort through some of those details.
Paula, compare the price of medical care with other pricing issues, the cost of living, inflation in general.
Well, it's gone up.
Right, but I mean in terms of importance to you, I'm sorry.
I'd say it's most important, and particularly the prescription piece of it, too. There are all sorts of drugs. The Inflation Reduction Act has helped control costs and allow the negotiation along the way. But I'd say it's a prescription, the cost.
Yeah. But when people, some of these races, inflation is a major factor, and it's really a major factor in the election. Let's be serious.
Oh, of course.
But inflation for groceries, inflation for medical care, which is more important to you?
As a senior, I would say medical care.
Yeah. Melanie, what about you?
Same. I would agree with that. Everything has gone up tremendously. I quite honestly have an insurance broker for my second insurance because I cannot fathom going through all those different plans. So that really has helped me, and he's very straightforward, and he is there on my behalf to guide me through the whole thing. So, yeah.
So with that in mind, yeah, inflation is serious, but the inflation in terms of medical costs, that's number one for you.
Correct.
All right, I want to talk about home care, assisted living, nursing care. Again, is that an issue where a candidate might come along and say X, Y, or Z, and that's the candidate you're going to go for because that candidate said that?
There are factors with getting into assisted living facilities, which I've gone through with my family recently. The complexity of it and the cost of it are really barriers. They're structural barriers to people getting the care that they need. To be able to age in place at home with home care services, equally complex, equally expensive, because it's not a covered service. So if someone were to come forward and say there's a means by which we could have that be a covered service, would be extremely attractive to me, whether it's supporting families, to be able to be in that caregiver role, or to be able to get those services from outside companies would be of enormous value.
I hear about aging in place and home care and assisted care facilities and all of these issues, insurance for these kinds of long-term care and this kind of business. Again, how important is that particular aspect of healthcare to you?
Well, I live in a continuing care retirement community, and of course, it's very important, and I have a personal interest in it. But the staffing, I found the biggest challenge right now for any kind of facility is the staffing. They can't find the people that are trained and enough of them.
If a candidate comes along and says, I've got a way to fix that, that gets your interest pretty quick, I would imagine.
Well, it does, but actually proposals don't mean as much to me as prior records. So the fact that the Inflation Reduction Act was signed, that's something tangible that is actually really working and addressing some of these issues.
Okay. So that's interesting in terms, and Melanie, for you, in terms of healthcare issues, things that were done as opposed to ideas that are put forward, how do you compare?
Could you clarify your question, please?
Yeah, well, let's say I've got an idea to change something.
Okay.
Let's say my opponent has already done this to change something.
Okay.
What's more important, past record or promise?
Past record.
You think so, huh?
Yeah, yeah,
Oh, yeah.
yeah.
Even if the promise might benefit you more?
It really depends on what they're telling us.
Yeah?
Yeah. I mean, promises, as we know, politics are always promises, and they're not always kept.
And in a difficult situation like healthcare, which can be so confusing in so many ways, do you tend to look backward more than you do forward?
Well, I think more about my mortality right now, and a burden that would be on my only living relative, was my son.
Right.
So I don't want him to have to fathom through this, and I'm trying to protect him as well as myself.
Yeah.
Because it's a big deal to put on a family, especially if they've had no experience.
Yeah.
Yeah, and I agree with Marcia too. I had that with my mother, and I quite didn't know how to do it.
Yeah.
And I had to rely on social workers and things like that. And I'm not saying that they weren't doing their job, but as you said, Paula, everyone's stretched to the max.
Yeah.
So
Let's talk about financial scams and frauds. From some of the surveys that I've seen, that is very high on the list, especially when it comes to healthcare, but in general. High on your list?
Very high on my list. The disinformation and misinformation that is propagated through social media, through other forms of communication, can be very confusing, especially if you're talking about a population who may be less sophisticated in drilling down and wading through what some of the details are. You see that just repeated again and again when you talk to people about healthcare issues, suspicion of technology, suspicion of things as straightforward as vaccinations, things like that, how you get people media literate, and how you get people to a point where they can intelligently, or at least in some more sophisticated manner, recognize when something's coming in. If it sounds too good to be true, it probably is too good to be true.
Yeah. Please, do you want to say something?
No, if it's too good to be true, then it probably isn't.
Financial scams, fraud, the idea of clamping down on that, focusing on that, how big a deal to you?
It's a big deal. It's scary. It's very scary because it's so easy to get trapped into, something pops up on your laptop and you're like, oh, well, that looks interesting. And then you go down this rabbit hole.
But in terms of going to the polls, where you live now, the folks that you live with, your friends, neighbors and such, do they talk about scams and fraud very much, or is that kind of down the list a little bit?
I'd say the continuing care and the funding and the inflation and costs are more talked about than scams.
Friends and neighbors for you, Melanie, what are you hearing?
Not any. I mean, that's not anything that we talk about.
Isn't that interesting?
Yeah, yeah. And I know it's prevalent in this, especially with older people. Yeah.
We're running out of time here, but I want to get a quick answer. Melanie, we'll start with you. Are you a single issue voter when it comes to health care?
Yes.
Wow, all that time and you said yes. I thought for sure you'd say no. Paul, what about you? Is this enough to make you say, I can deal with that other stuff, but this is more important?
If your definition of health care includes all ages,
Yes.
not just the seniors, then
Yes.
I would say yes.
Yeah, what do you think?
I don't know that it's a single issue for me right now. I think it's an important issue, but it couldn't be somebody who came to the table with all of the healthcare related things and then was not like addressing other key lifestyle or economic issues.
Yeah, so there are other things up top three maybe?
It's in the top three,
Yeah,
for sure.
all right, well, we got you there then. Good. Good conversation. Good to have you all here. Thanks
you.
for joining
Thank you.
us.
Thank you very much.